Welcome to our Women's Health podcast series. My name is Abigail Hole and I'm a Communications Assistant at Bournemouth University. Through this podcast, I'll be speaking with members of Bournemouth University's Centre for Midwifery and Women's Health to learn more about women's health and the amazing research being conducted by the centre. In this episode, I'll be introducing you to the leading woman from the Centre for Midwifery and Women's Health. Would you mind introducing yourselves and your main areas of expertise?
Hi Abbie, I'm Vanora Hundley. I'm Professor of Midwifery. My background is reproductive health, so I've been working in the areas of early labour, how we support women through childbirth.
My name is Catherine Angell. I'm Associate Professor of Midwifery at Bournemouth University and I'm Head of Department for Midwifery and Health Sciences. And my research interests are really around infant feeding and midwifery education.
Hello Abbie, my name's Carol Clark. I'm Professor in Physiotherapy in the Centre for Midwifery and Women's Health. My areas of interest are around pain, management of pain, self-management of pain. In particular, I've been working with Professor Vanora Hundley looking at pain in labour and finding out about women's pain experiences pre and post-labour.
And could you tell me a bit about why the centre was set up and your partners and friends within the community?
Yeah, so we've got a long history of research here at Bournemouth University. The midwifery research goes back 3 decades, and the original centre was the Centre for Midwifery, Maternal and Perinatal Health. Over the last couple of years, we've really begun to introduce more interdisciplinary research, working with colleagues such as physiotherapists, Carol here, but also working with colleagues in media and also in digital health. So we're beginning to really broaden it into 4 different areas. We have, as you've heard, infant health and postnatal care. That was our origins, and that's led by Associate Professor Catherine Angell. We have international health, which is led by Professor Edwin van Teilinger, who's not able to be with us here today. We've got myself, I lead early labour and labour care. And then we've got the new area, which is women's health, and that's led by Professor Carol Clark. And that move from very disciplinary focused, midwifery focused, to more broader interdisciplinary focus has led to the change in name. And we're now the Centre for Midwifery and Women's Health.
Could you talk to us a bit about the Women's Health Strategy for England and how the centre is supporting the strategy's aims?
So in 2022, NHS England launched the Women's Health Strategy, and this enabled a broader focus on women's health and a broader remit around health and well-being of women across the lifespan, and recognising that although women live longer than men, this doesn't always correlate with greater quality of life. Within women's health, we're also working in Dorset with the Women's Health Hubs, which have been recently launched across England. But women's health goes beyond just health. We've also been looking at women in sport. For example, that's an area that has also lacked investment. For example, Nike launched the first women's football boot in 2023. And so women footballers playing in the 2022 European League and winning that were playing in men's football boots. There's been little investment in understanding the priorities for women's health, let alone technology development and the evidence behind that technology. For example, there are apps out there that track your menstrual cycle and provide advice about what stages of the menstrual cycle you should be exercising in. But the evidence doesn't necessarily stack up. However, if we look at other technology, seeing the use of, say, mobile apps that have been useful in improving adherence to exercises for pelvic floor muscle training to improve outcomes for those who have urinary incontinence. So there needs to be more of a focus on women's health. And I think the strategy for England, the strategy in Dorset, and our own strategy within Bournemouth University are all helping women's health.
And are there any research studies you are excited to see the progress of this year?
Well, I think we've all got some really exciting research going on. At the end of 2023, the Centre led nationally or internationally on early labour research, and we published a special issue looking at how we can support women in labour. That work we're bringing together in an early labour app, which is led by one of our colleagues, Dominic Myloyd, and we'll be looking at how we can provide women with information and support to enable them to be in a good place when they come into hospital and active labour. So that's something we're really excited about. From an international perspective, we've got some big work going on with Bangladesh, which is led by Professor Edwin van Teilinger, looking at drowning, and that's really changing the way that we provide information support to a low-resource country, which is really important. And we're working with colleagues there to really empower them and give them the skills they need to do the research.
So what is special about your centre?
I think one of the things that's unique about the Centre for Midwifery and Women's Health is that we really focus on fusion. We bring together colleagues who've got expertise in research, expertise in education, but also our practitioners, our colleagues working out in the NHS to look at how we can do things better for women and for mothers and babies. And a great example of that is around infant feeding.
Yes, so infant feeding really shows how we can combine research, education and practice all together. And we've got a 25-year history of really innovative and informative research around infant feeding. And we've engaged women, families, midwives and the general public in thinking about their experiences of infant feeding and their perceptions around it. And a really important part of that is how we then teach student midwives and midwives in practice to provide really excellent infant feeding care. UNICEF, through their Baby Friendly Awards, recognise universities that provide very good infant feeding education. We actually have their Gold Award, which is very unusual in the UK, and it shows that we've consistently provided excellent breastfeeding education and infant feeding education to our student midwives before they qualify and go into practice.
And what conversations do you feel we need to be having more of, what we are not talking enough about?
I think that going back to the fusion, our fusion thoughts, again, it's really important in women's health that we should be working with our practice partners in the community, with stakeholders, with the voluntary sector, and broadening that out. And that's what we're trying to do by working with the Dorset Women's Health Hub. For example, we're working with colleagues who are leading the pelvic health and perinatal project with the Dorset ICB, and we have a clinical academic doctorate student who is carrying out research in this area. We've been working with other colleagues on internships, so they get funding from the NIHR to look at elements of their research, but they're taking that immediately back into practice. And this was looking at pathways for women who have both urinary and fecal incontinence. Instead of having to go to 2 different clinic appointments, they're now working out a pathway where a woman can go to 1 appointment and meet both the nurse and the physiotherapist. And so making things like that better for women.
And I think going forward, we really need to be talking about these positive things. There's so much in the news that's challenging for the NHS, where we're short of staff, where we're struggling to meet targets. When we have this innovation and practice, we need to be shouting about it.
Thank you so much for joining me on this podcast. I look forward to meeting some of the amazing researchers linked to the Centre for Midwifery and Women's Health. Please join us in our next episode, where I'll be speaking to Anna Marsh, clinical academic, about how social media can be used to improve communication between midwives and women. If, in the meantime, you'd like to find out more about the Research Centre, please visit the Bournemouth University website.